Anne Burrell, 55 years old, vibrant Food Network star, charismatic, died suddenly of sudden cardiac arrest. Let me tell you what sudden cardiac arrest is so I can give you an idea of how you can prevent it. I'm Dr. Simpson. If you like this information, give me a follow. Sudden cardiac arrest is like an electrical problem. It is not a heart attack. A heart attack is like a plumbing problem, meaning that in a plumbing problem, you're not getting enough blood flow to the heart for whatever reason from the cholesterol, and your heart can't sustain it and you die. An electrical problem is you're walking, talking, doing just fine, and then all of a sudden, it's lights out. 50% of all cardiac deaths in the United States come from sudden cardiac death. You may not even know you have heart disease. Most of them don't, and their first manifestation of heart disease is sudden cardiac death. Now, there's a number of underlying causes of sudden cardiac death. Let's go through them. Number one, coronary artery diseases. The plumbing problem can cause a problem with the electricity. Think of it like a flood in your electrical panel. Number two, you can have people who have what we call cardiomyopathy, an overly enlarged heart. That can happen from prolonged hypertension. It can happen from valvular disease. It can happen from infections like COVID or Coxsackie or rhinoviruses. Number three, electrical disorders of the heart. There are some people that have primary electrical disorders of the heart, things like prolonged QT syndrome, atrial fibrillation, ventricular fibrillation, all of those things which can be managed. Sudden trauma to the heart can cause it. You probably heard of people who got hit in the heart with a baseball, all of a sudden their heart stopped and they had to do CPR, or a football guy getting hit suddenly by a linebacker, heart stopped and they had to do CPR and they saved them. And finally, there are undiagnosed heart defects in young athletes. Young athletes, some young people have very, very large heart muscles, so large that they can't even fill the heart to do its deed. That's why now with young athletes, they typically do echocardiograms on them to find out. So what can you do to prevent this? Knowing that starting at age 35 is when we see this spike in sudden cardiac deaths and ending at age 75, what are the underlying causes? Primarily causes number 1 through 10 are underlying heart disease. And underlying heart disease meaning cardiovascular disease from atherosclerosis, meaning too much cholesterol in the blood. Now I know the shirtless salesman of supplements and scams are going to try and convince you that cholesterol isn't the problem and it's a lipid hypothesis. They're absolutely dead wrong. And if you don't get your cholesterol checked, you're dead wrong. Did you know that some young people have cholesterol levels so high that they have heart attacks in their teenage years? Cholesterol has been the problem. We have known it for 70 years. It's not a debate among people who are reasonably thinking individuals. So, if you want to prevent it, here's some things you should do. Starting at age 35, get your cholesterol checked. Get your blood pressure checked. If they're too high, get them managed. The lifestyle changes will come along with that. Number 3, please stop smoking.